Hello, this is Dr. Michael Gaeta. A few words about measles, measles hysteria, and measles vaccination, and measles or vaccine mandates. First thing is that the measles vaccine does not save lives. There is no demonstrated mortality reduction from the measles vaccine, which is only available in the form of the MMR, the measles, mumps, rubella vaccine. So the death rate from measles 100 years ago, 1915, was about 15 people per 100,000 in the population. The death rate from the measles declined about 99% in 1962. So there were about 400 deaths from the measles in 1962, which is a 98% reduction in mortality. And this was the year before the vaccine was even available. There will always be measles outbreaks, but measles, because of improvements in sanitation, nutrition, hygiene, living and working conditions, ceased being a deadly disease several decades ago, and the vaccine did not decrease mortality at all. Now, the CDC, the utterly corrupt CDC, which is itself a vaccine company, which holds dozens of vaccine-related patents and brings in $5 to $6 billion a year in licensing these vaccine-related patents. The CDC lied, what a surprise, in claiming that there was no relationship between the MMR vaccine and autism. Their own research proved that there was a causal relationship between MMR and autism in certain susceptible children, and then lied, manipulated the data to hide that fact. And that is the subject of the documentary Vaxxed and the book Vaccine Whistleblower. And you can read more about that and how the CDC manipulated the data to eliminate the association between MMR and autism. Now, MMR is much more dangerous than the measles itself, which is just a 1-week rash like chickenpox. And the MMR, there have been dozens of reported deaths caused by the MMR vaccine over the past 10 to 15 years. In that same time period, there hasn't been a single demonstrated case of mortality from the measles itself. The 1 or 2 reported cases had multiple other conditions, other diseases, much more serious than the measles. And so there were a whole host of pre-existing conditions and no conclusive evidence that the measles itself was the cause of death. There are many, many other reasons for why these patients would have expired. So the MMR vaccine also is responsible for, as of today, about 92,000 reported adverse reactions to MMR in the Vaccine Adverse Reporting System database. If you go to a website, medalerts.org, medalerts.org, you can search the VAERS, or the Vaccine Adverse Events Reporting System database. Remember that vaccines are the only class of drugs where now, to date, 700,000 reported adverse reactions have been almost entirely ignored. For every other class of drugs, if there were that many reported adverse reactions, there would be an investigation and proper research and probably fines, recalls, all the things that happen with dangerous drugs. Vaccines get a free pass, and 700,000 reported adverse reactions, when we know, according to FDA, only 1 to 10% of adverse reactions are even reported. So that 700,000 reported adverse events could be 700,000 or 7 million adverse events caused by vaccines, just since the reporting system was instituted in the late 1980s and early 1990s. So the MMR vaccine is much more dangerous than the measles itself. Now, where there's a risk, there must be a choice. And we know that vaccines do cause injury and death in susceptible individuals, especially children. And so where there is a risk, there must be a choice. And the whole idea of a vaccine mandate where there is no choice, no informed consent, no parental rights, no healthcare freedom of choice, no personal bodily sovereignty where you get to decide what happens and what goes into your body is a massive ethical violation. In medical ethics, it is impermissible for any intervention to be done without the patient's full, informed, voluntary consent. So this is the height of medical fascism, I guess you would say. And the maker of the MMR, Merck, is being sued in federal court for faking the effectiveness data of the mumps part of the MMR vaccine. And we see this because a large percentage of patients who get the measles have been vaccinated. An even larger percentage, the estimate is 90% of everyone who gets the mumps has been vaccinated. And so it appears that this vaccine is quite ineffective in effectively eliminating the measles, which doesn't really need to be eliminated because it's only a 1-week rash like the chickenpox. This is a non-fatal, non-serious disease. According to government statistics, incidence of complications is at most 1 in 1,000. The vaccine is much more dangerous than that, and the damage caused by the vaccine is much more serious than the typically mild complications of the measles infection itself. So this is very significant. Now, the worldwide courts have confirmed that there is a causal relationship between MMR and autism. The U.S. Supreme Court has classified all vaccinations or referred to all vaccines as unavoidably unsafe products. And so this is a very serious issue where personal rights are being trampled in the name of herd immunity. And just to be super clear, there is no such thing as herd immunity from vaccinations. There is herd immunity, and this was demonstrated back in 1934 from naturally acquired or wild infections in a community. And it was demonstrated that it was only 68%, about 2/3 of the community would have a naturally acquired infection to reduce the incidence or likelihood that the other third of the community that did not get the disease, they were much less likely to contract that infection because there were enough folks in the community that had lifetime immunity to that condition, having gone through it themselves naturally. Since vaccine effects wear off in 2 to 3 years, there is no herd immunity in the United States or any country. There never has been, there never could be, there never will be herd immunity from vaccines because some people don't respond to vaccination in terms of antibody stimulation, which is all a vaccine does, is temporarily stimulate antibody production to synthetic pathogens or antigens. And that we call that primary vaccine failure or non-responders. And also because of secondary vaccine failure, which simply means that vaccines wear off fairly quickly, typically within 2 to 3 years. And so there's never been herd immunity in the United States. Most of the American population has had no vaccine antibody stimulation in several decades, and there have been no resurgent epidemics of any of the vaccinated diseases, even though the majority of the population has no antibodies to these conditions. So clearly, vaccines did not save humanity. They never will. They did not eliminate any epidemic at any time in human history. And so this whole herd immunity argument is completely ridiculous. It is just misinformation, propaganda, lies, myths, whatever you want to call it. And so due to all of this, and I've only covered a few of the key points, is that each of us needs to get involved and get in the game and become activists, not against vaccines, but for vaccine choice and fully informed voluntary consent, healthcare freedom of choice, and parental rights. And so get in the game. There's a variety of resources that are available to you, which to all of us, since now Facebook, Google, YouTube, Pinterest, basically every social media platform is now aggressively censored against any reputable vaccine science or evidence or anything which is pro-choice. And so now we live in an age of fascism and censorship. This is very unconstitutional, clearly, and so violating free speech. The websites, there are several, just a couple that you want to think about, is nvicadvocacy.org. nvicadvocacy.org is a citizen activism service. It's free and private. They'll tell you what's going on in your state to either expand vaccine choice, which we want to promote, or to curtail or impede or eliminate vaccine choice, which should be completely eliminated. And so you can get active and get all the information you need through that service, and they'll tell you what's going on in your state. Other good resources is learntherisk.org, icandecide.org, generationrescue.org are a few. You can also look at vaccines.mercola.com. So there's a variety of areas. And also I've written about this extensively, and we'll offer you a free course online, a free online course entitled Vaccines and Choice, which includes my ebook on the subject, and it's free. Just go to michaelgaeta.com, michaelgaeta.com, and you can sign up for the free online course, Vaccines and Choice. So get in the game. This is a very serious situation that's going on today with measles hysteria. Again, of course, nobody's died. This is not an epidemic. This is just an outbreak. No big deal. But get in the game, get involved, and to preserve informed consent and healthcare freedom of choice related to vaccines.